Table of contents, about 4 sections. 1. The first steps in the hospital, navigating early recovery. 2. Transitioning to home, managing your new normal. 3. The post-surgery diet, a new way of eating. 4. Staying vigilant, when to call for medical help. Written by Dr. Sanjay Gupta. Section 1. The first steps in the hospital. Navigating early recovery. Undergoing pancreatic surgery is a significant event for your body. It is a major operation, often performed to address conditions like cancer. It is also done for chronic pancreatitis. The pancreas is a vital organ that makes powerful digestive juices. It also produces critical hormones like insulin. After surgery, the body needs time and support to heal. Your recovery begins the moment you leave the operating room. The initial hospital phase is about close monitoring and foundational support. This time can feel overwhelming, but a dedicated medical team is with you. Your hospital stay will likely be 1 to 2 weeks. It often starts in the intensive care unit, the ICU. In the ICU, staff watch vital signs 24/7. Heart rate, blood pressure, oxygen levels. Managing post-op pain is a top priority. You may get pain meds through an IV line, or via an epidural catheter in your back, or eventually as oral pills. Controlling pain helps you rest and join early recovery activities. Deep breathing exercises. Walking. You will wake up with several tubes and drains in place. That can be alarming, but each has a purpose. A nasogastric tube may pass through your nose into your stomach to keep it empty. Surgical drains sit near the incision to remove excess fluid. That reduces pressure and lowers infection risk. Nurses check and manage those drains daily. Section 2. Transitioning to home. Managing your new normal. Leaving the hospital and returning home marks a major milestone in your recovery. Transitioning home means you and your family take on more of your care. The first few weeks at home are critical for healing and adjusting. Focus on 3 key areas: managing your incision, taking your medications correctly, balancing rest with light activity. Fatigue is one of the most common challenges after this surgery. Your body uses a tremendous amount of energy to repair itself. Feeling tired is normal. Listen to your body and allow plenty of rest throughout the day. Proper wound care prevents infection and helps the incision heal. Before discharge, a nurse will give specific instructions for your surgical site. That usually means keeping the area clean and dry. Wash your hands thoroughly with soap and water before touching the incision and after touching the incision. You'll be told how often to change the bandage and what to look for. Check the site every day. If you notice increasing redness, swelling, warmth, pus-like drainage, or the incision beginning to open, contact your surgeon's office immediately. Your relationship with food will change significantly after pancreatic surgery. Your digestive system is now fundamentally different. You must learn a new way of eating to support your recovery and long-term health. The process begins slowly in the hospital. Clear liquids, full liquids, soft, solid foods. The guiding principle is to eat small, frequent meals. Instead of 3 large meals, aim for 5 and 6 smaller, nutrient-dense meals. This places less stress on your digestive system and helps absorb nutrients. Hydration is very important, but timing your fluid intake is a new skill. Aim for 6 to 8 cups of fluid a day. Avoid drinking large amounts with your meals. Drinking too much while you eat can make you feel full too quickly. Drink fluids 30 to 60 minutes before or after meals. Protein should become the star of your plate. Include a source of lean protein with every small meal and snack. Baked chicken, grilled fish, eggs, low-fat cottage cheese, Greek yogurt, tofu. If you struggle to eat enough, your doctor or dietitian may recommend protein powder. Your recovery journey is a partnership between you and your medical team. While you are at home, you become the primary monitor of your health. It is vital to know which signs and symptoms warrant a call to your doctor. Do not hesitate to reach out if you are concerned. It is always better to be safe. One of the most important things to watch for is a fever. A temperature of 101 degrees or 38.3 degrees or higher. A fever is often the first sign your body is fighting an infection. Possible infection sites: incision site, lungs, inside the abdomen. Prompt medical attention is necessary. Pay close attention to your abdomen. Call also for severe abdominal pain or for worsening abdominal pain, especially if pain comes with nausea or vomiting that prevents you from keeping down food or liquids. These could indicate a complication such as a blockage or a leak from a surgical connection.